All right, guys, we're going to start now on the academic clinical trials. We have four amazing speakers, and each is going to speak for 10 minutes, which will be 5 minutes to ask questions, so that will keep us on time. The four speakers, if you do the math, will be done in an hour. So with that, let me introduce Yedda Li.
You are not supposed to do that.
I can go ahead and introduce myself as the slides are being loaded. I am Yedda. I am from Mass General Hospital, where I work with Dr. Eichler. I'm an adult neurology resident, and I'm doing a neurogenetics fellowship next year. I'm doing my last year of residency right now. And my goal is actually to establish an adult leukodystrophy clinic. All right, so today, women, this talk is for you. So that's my shortest slide. So talking about women with ALD, I think it's quite well established now that women with ALD experience a wide variety of neurological symptoms that unfortunately negatively impact quality of life for a lot of people. These are just some of the studies. This is probably not an all-inclusive list, but the most recent one done in 2023 by Dr. Schaefer's group showed that 72% of women were symptomatic, and this was one of the largest cohorts of 180 patients. So, you know, I don't think I need to tell this group that we need many more studies on women and how the symptoms affect your lives, and more importantly, what we can do to treat that and improve quality of life for everyone. So on that note, I'm going to talk about 3 clinical trials that are going on at Mass General Hospital right now. 2, we are kind of in the data analysis phase, and I can share with you the data that we've gathered. And then the last one, I'll be focusing in on more detail. We are currently enrolling for that one. So the first trial is a natural history trial. There's 2 parts to that. There's a retrospective chart review of 79 patients, and then a prospective interview of 30 patients. And the goal of this study basically is to understand exactly what symptoms affect women, what are the abnormal neurologic signs that we see on physical exam, and more importantly, in your own words, how do these symptoms affect your quality of life? The second study I'm going to be talking about is a movement disorder study that basically there's 3 components, again, a prospective, a retrospective component, and then also a brain MRI component where we look specifically at brain MRIs in women with ALD to see what areas are affected. And then finally, I'm going to be focusing most of this talk actually on restless leg syndrome. This is a movement disorder or sleep disorder that disproportionately affects women. And there are 2 phases, and basically I'll be talking about the purpose of phase 1 is to figure out what the prevalence of restless leg syndrome is in women, and then phase 2 is really how can we treat this. All right, so quickly going through the natural history study. In the retrospective study, we looked at the charts for 75 of the women, and 93.3% of the patients actually had at least one neurologic symptom or sign. And for the non-healthcare workers here, symptoms are subjective as reported by the patient. Signs are objective signs that clinicians see and record on physical exam. And so you can see that the most common symptom that patients report is neuropathic pain, and going hand in hand with that, the most common sign is impaired sensation. And we also thought it was interesting to look at what the initial symptom or sign is for women. And you can see that pain and gait and walking difficulties take up about 25% each. These are the most common. All right, looking at the quality of life. So this is part of the prospective study where we did 1 to 2 hour interviews with 31 women. And 84% had reported that ALD has a negative impact on their overall quality of life. And unfortunately, a little more than 1/3 said that ALD had a severe impact on their quality of life. Most common contributors, the most common contributor is diagnosis in a family member. but also their physical symptoms, the management of those physical symptoms, how their own diagnosis affects their family, and mental health symptoms. So to me, all of these are really modifiable contributors, certainly diagnosis and family members, and how that impacts, how their own diagnosis impacts family members, you know, kind of involve other people as well. But the physical symptoms, the management of care, and the mental health symptoms are things that certainly I think we can get at right now with the studies that we're doing. Okay, so one of the things that women really face is barriers to care. And I think this is true for ALD patients in general, because ALD is unfortunately not a well-known diagnosis or commonly seen diagnosis, even among neurologists. But women especially face a lot of barriers to care. And the most commonly reported barrier is a lack of knowledge about ALD among local providers. Here, I hope you can see the text there, but going in descending order, carrier misconception. Sorry, I said that bad word. It is a misconception, but unfortunately, that misconception is quite prevalent in the general community still. Difficulty finding a specialist, difficulty getting resources, high travel expenses. A lot of these things I think we heard yesterday from our patient panel. So that's it for the natural history study. I'm going to move on to the movement disorder study. So when we think about movement disorders, a lot of the movement symptoms actually disproportionately affect women compared to men. So here you have a list of the movement symptoms. In the light blue, that's for women, and in the dark blue, that's for men, and the y-axis is kind of frequency. Here you can see that for tremor, dystonia, and abnormal speech, women at least trend higher than men in terms of frequency of these symptoms. So what's interesting is that women who are affected by these movement disorders, that's actually independent of the demyelinating disease seen in men. Okay, so looking at the brain MRI changes, trying to figure out, there is a kind of almost misconception that most women have normal brain MRIs. So we really wanted to look at this. So on top here, let's see if I can get this to work. Okay, sorry, I don't know how to work a Mac. Let's try this instead. Okay. The control hotkey doesn't work here. That's okay. I will use this. All right, there we go. So on top here, these are ALD patients, and these are age-matched patients who don't have ALT, both women, obviously. You can't see this, but this is basically patient number. There's 17 patients in each group. And then here you also can't see that, but that's basically the age of the patient. And it's to show that the ages are matched. Here, for each column, that's an area of the brain, and the green is normal, yellow is moderately affected. The redder you get, the more severely affected you are in these different regions of the brain. And you can see that for both for ALD women and non-ALD women, the changes in the brain, the white matter changes increase as age goes up. But for ALD women, the changes actually start happening sooner. Okay, so looking at the brain MRI here, so for non-healthcare workers, I like to think of the brain MRI as these are the eyes, this is the back of the head, and you're kind of lying in the scanner with the feet pointing outwards and the head pointing into the screen, and right is actually on the left and left is on the right. Having said that, I really want to draw your attention to the midbrains as a part of the brain here. That's kind of blown up here to bigger size so everybody can see. There is an area of hyperintensity, which is abnormal, that I've delineated here, that we do see in a lot of brain MRIs from women with ALD. And the hypothesis, this is actually where the cerebellar, the superior cerebellar peduncle decussates, which just means it's the connection between the cerebellum and the rest of the brain. So it's how the cerebellum communicates with the rest of the brain. And decussation just means it crosses over to the other side. And so this pathway is abnormal. Okay. Moving on to a specific type of movement disorder, restless leg syndrome. I'm going to talk about both phases.
Running out of time. How many more slides do you have?
Oh, I can quickly move through maybe like
about a minute.
Okay, that's fine. Okay. Let me just quickly move through this then. Basically, restless legs is an urge to move the legs when paired with an unpleasant or uncomfortable sensation. And restless leg syndrome disproportionately affects women much more than men. And unfortunately, patients who have restless leg syndrome are also much more likely to have myelopathic symptoms. So the trial design is here. I'm going to go through each with you briefly. The goal of the first phase is basically to assess leg-related symptoms in women. Our collaborators in Amsterdam are also working on this project. And the most important thing, if you want to participate, you can email our clinical research coordinators here, Liz and Elise, who are both here today. Or you can also scan this QR code to participate. The phase 2 is actually a therapy. The question is, does pramipexole, which is the first line treatment for restless leg syndrome, can that significantly reduce restless leg symptoms for women specifically with ALD? Because that has not been studied. This is a continuation of phase 1, so you do have to participate in phase 1 to be able to participate in phase 2. But basically, we measure your symptoms, both objective and subjective symptoms and signs. So the last take home of this particular study is that this is a crossover study, which just means that patients can get both pramipexole and placebo, and it's in crossed orders. So basically, the first group of patients can get pramipexole first, and then followed by placebo. And then the second group of patients gets the placebo first, followed by pramipexole. So all the patients do end up getting the actual therapy. Okay, so questions? Wanted to...
Thank you. Thank you.
Yes.
I know that women have been asking for quite some time to be studied, so thank you. With that, is there questions that you have for?
Just as a hematologist, restless leg is also linked to iron deficiency anemia. So be sure you screen women looking at ferritin before you treat them with another drug.
Yes, thank you. So that's something that we're actually aiming to find out. A lot of the initial symptoms start in the 30s. I don't know if restless leg specifically also starts in the 30s.
Hi, thank you for your presentation. My mother is a symptomatic woman with ALD, and she's been taking pramipexole for probably the last 10 years. Like, would she be able to participate in a study or trial like this, having previously taken it so extensively?
That's a good question. I'm not sure, to be honest with you, but I can find out and I can come let you know afterwards.
Thank you.
Mm-hmm.
Yes, I was just wondering if you could elaborate a little bit more on what exactly that disformity in the brain would cause.
Yeah.
What kind of symptoms would that be
Absolutely
responsible for?
So the cerebellum is actually important for a variety of different functions. And those include coordination, movement, even some emotional regulation. And the superior peduncle here, what you see is basically the connection between the cerebellum and the rest of the brain. So it's how the cerebellum communicates with the thalamus, which is kind of the relay center of the brain, and how all of those interconnections then happen. So you know, if there is a problem with this particular connection, we would expect to see potentially some movement related disorders, coordination related disorders, and symptoms like that. I don't believe so. That wouldn't be something that we would commonly see.
If
Oh,
she asked
sorry.
if it would affect the eyes as well. Any other questions? Wait.
Okay, I'm sorry. I want to ask some nerdier questions. I'm just taking advantage of the opportunity. Speech, right? Also,
Absolutely, speech, 100%.
so do you feel like this hyperintensity is inflammatory?
We honestly don't know. Generally, with hyperintensity on FLAIR and T2 sequences, it's kind of myelin damage. It could be inflammatory. Certainly, we know that inflammation plays a big role in ALD.
And you mentioned it was, you said the slide before that was age-related changes, normal brain age-related changes were accelerated in women with ALD. Is this fall into that category or is this separate?
You mean this specific finding in the brain?
Is this an age-related change?
No,
No.
we don't generally see this with aging.
Okay, okay. And then lastly,
Mhm.
sorry, I'm just
That's
taking
okay.
advantage of the situation. So you mentioned something about, and I didn't catch it. You said restless leg syndrome and something about the myelopathy or spinal cord changes. Could you just reiterate that again?
Yeah, so we found that patients who have restless leg syndrome are at higher or have more of a likelihood to have other myelopathic signs. So here on the x-axis, you see all the different myelopathic signs and symptoms. And for specifically for gait and balance difficulties and and pain, this is actually a significant difference between patients with restless leg syndrome in the dark blue and patients without restless leg syndrome. So you can see it's much more likely to be seen in patients with restless leg syndrome.
Yeah, thank you. Here in the corner to your left. Yeah. I was wondering how objective are the changes on MRI that you observed? And were the scans analyzed in a blinded way? Because we also see, for instance, in T2 images that there's kind of this haze in ALD patients, or so we thought at least. But then when we asked the radiologist to analyze those scans in a blinded way, we couldn't really see the difference. So I was just wondering how sure are you really that these changes are objective and not just, you know, for instance, the corticospinal tracts can also be kind of give this wide image, but
Yes.
it doesn't really mean anything.
Absolutely. So that's a great question, actually. So Dr. Rappolino is a neuroradiologist, and he's actually kind of spearheading this project of looking at the brain MRIs, and he's basically looking at Hounsfield units with appropriate controls to look at whether this is real or not. Any other questions?
And just to be clear, that's just one patient each, like these are low end sizes.
Yes. Yeah. This is just one patient, the MRI I'm showing here. Yeah.
Okay, thank you, Yedda. Appreciate it.
Thank you.